All right, welcome everyone. Happy Tuesday. So excited you decided to join us this last week of September. Thank you for being here tonight. My name is Dr. Stacy Holweger. I am joined by Dr. Dan Collins this evening. He is a chiropractor I had the pleasure of meeting a couple weeks ago up in Grand Rapids, Michigan area. Livonia is where I was at the time with Cindy and Casey Johnson and Susan and Dr. Don Verholst. So thank you, Dr. Dan, for joining us tonight. I'm going to share a little bit of information and then I'm going to introduce you and turn it over to you. So for those of you that are guests this evening, this presentation is going to be informational about Lifewave, the X39 stem cell activation technology, and I'm sure we're going to mention some of the other patches as well. But Dr. Dan is going to be sharing with you information about this tech, how it works, the science behind it, and all the goodies that he has presented for you in his presentation. We will be doing a little bit of Q&A at the end. You can, of course, type in the chat. You don't have the ability to unmute yourself, but you can type questions in the chat. Remember that the information that's shared tonight is for informational purposes only. We are not medical doctors. We are not your doctors. And so if you have questions about your health, please check with your doctor, your healthcare practitioner. The information shared tonight is not intended to treat, cure, or diagnose, of course, anything at all. So I do want to give a little bit of info and background about Dr. Dan. He's going to share a little bit more. So like I mentioned, he is a chiropractor from the Michigan Doctor of Chiropractic at Sherman College, Spartanburg, South Carolina. He actually has a degree as well as applied biology and sports medicine from Ferris State University. I said Big Rapids, sorry, Big Rapids, Michigan. Yes, and so he is Michigan State Board licensed chiropractor, but his credentials are honestly 3 pages long. I was blown away reading all of this information, and he is world renowned as an inventor and his own technology he'll be sharing with you tonight within chiropractic. He has been published in numerous publications over the years. He is in private practice as a chiropractor since I believe early 2000s, 1994, maybe even, I'm sorry, 1994. Yeah, 94. And he also lectures all over the world. So I'm talking Japan and China, Greece, Poland, Germany, Netherlands, just all over the world lecturing on chiropractic and his technologies and what he's created and invented himself and teaching. So, and he has an honor and award of Who's Who in America, which is pretty amazing. So we're so honored to have you here this evening, Dr. Dan, to share with us your expertise in the area and why you chose Lifewave, of course, to be in your practice. And I just like I said, so impressed with your presentation a couple weeks ago. I'm honored to have you on here. So if you could share with us, are you okay for me to go ahead and screen share tonight? Is that okay? We're good for that?
I'd love the slides. Yeah, that would help. Absolutely. Thank you.
Wonderful. Okay. So we are going to screen share and we can see this okay? Are we good? Can you see that all right?
I can see it perfect. Yes. Are we ready?
Yes.
All right. Well, hello. I'm Dr. Collins. I appreciate everybody coming in and spending time with us tonight. And the biggest thing I want to accomplish tonight is actually to have you learn something. And so hopefully with my presentation here, I'm going to tell you a little bit about how I got into Lifewave, how I started, where I'm at now. I've only been with the company maybe 5-6 months. And then I'm going to go into research, because one thing that I do is I do research. I've been published, and I do lecture around the world on this research and also the instrument that I developed. And I'll just talk briefly about it. But the instrument I developed and why I'm so intrigued with Lifewave is because it actually treats the spine with frequencies. So I've been developing this since the early 90s, and now it's so common to read a lot of published articles lately about sound therapy. So sound therapy or frequency therapy, I'm going to use those as AKAs, but that's what I'm going to talk a little bit about today. But before I start that is because I've been published with research, and I've talked to many people about research. Some people don't understand really what research is. So what I'm going to do is just break down real quick about no research, what clinical research would be, and what peer review research would be. So go ahead and go to the next slide, if you would, Stacy.
Absolutely.
Oh, it did not. Oh, there you go. And what I say with this is all research is not the same. So if you see the pyramid right there, you can see it says no research, it says clinical research, and then peer review research. And then I put an arrow of invest. What I mean by invest is your time and your money. So that's very important for everybody. So when I look at these three levels or three different types of approaches, when you have no research, what that means is, go ahead and click that one more time. That means you're not really going to want to invest too much in something with no research unless you understand or trust the person that is actually presenting the product. So if you have a product and there's absolutely no research behind that product, it's really a trust situation, whether this person is lying, is not lying, or even making the claims that they made. So this is when you go into no research with the product, you maybe want to question if you're really going to waste your time and money on that. Go ahead and click to the next. But then if you look at clinical, now clinical, I do a lot of clinical, and also Lifewave has done a lot of clinical. So clinical is excellent. I love it, and I think it's absolutely needed. But with clinical, it's still going to be biased. And why I say that is because I've done a whole bunch of clinical on my machine that I developed. And with this machine, I'm biased towards it. And there's no way I cannot be biased. I have to be biased because I love this machine so much. So if I'm an inventor of anything, there's of course going to be bias towards that product. So the clinical research is very good to read, but realize it's a biased opinion. Go ahead and push the next. But if we look up at the peer review, now the peer review, that is what it means is that your research goes from clinical and you submit it into the journals. Now what the journals are the peer review journals. They call it peer review because those are my peers. So what I'm doing is I'm submitting my paper to the peer review. These peers on the editing board have no connection into the product. So they're not getting paid financially. They're not being bribed in any way. So they're going to look at this paper and they're going to decide, is this biased? Is it not? Is it good research? Is it not? So if it's not biased and good research, what they're going to do is publish it. So when doctors say I'm published or I'm peer reviewed or I'm journaled, what that means is that they got through their peers, and this is really true good research. So I tell everybody this because a lot of people think all research is the same, but it's not the same. The clinical and peer review is by far the best to go off of your time and money to put in that product. So that's why I kind of go through those slides real quick. Go to the next one. So if we come to the
hang on one second, Doctor.
Oh, yes.
Yeah, and I want to re-screen share. Someone has decided to draw all over that one for some reason. I don't know how that happened, but go ahead. We're good now.
Okay. So now we'll go into David Schmidt. And everybody, you know David Schmidt because he owns the company and he's also the creator of this wonderful technology. So what I did is I went and the beginning of the Lifewave, why I got into it. So I gave the outline of where I'm at, the frequency adjuster, and then also the researcher. So when I look at that, then I got approached about 5 months ago by a practitioner that I really, really trust a lot, been knowing her for about 40 years. And when she approached me and said, you have to try these patches. At first, I get approached by a lot of people. So I said, yeah. And I kind of blew it off a little bit. But then I said, give me 2 months and then I'll see if I like it. So I used them for 2 months and I wanted to see if anything changed. And I didn't look into the science. I didn't look into what these did or anything. I just got a basic review and I tried them. Now, I am blessed because I don't have a lot of symptoms. But one thing I did notice is that within the first 2 weeks, my energy was very, very smooth and even. I didn't have the up and down anymore. And then what was even better after the 3rd and 4th week is my focus. My focus was so more exact. Usually I get in the zone a lot, but maybe 5 days a week, 4 days a week. And everybody knows and understands what that zone is. Because when you're in that zone, I mean, life just doesn't go wrong. And you can think sharp. Everything clicks like you wouldn't believe. Well, I'm in that zone a lot more wearing these patches. And the patches that I started with is just 39 and 49. That's it, So I started with those patches. Now that I did them for about a month, I was really intrigued. So then I started digging deeper and deeper into what this patch is, because the explanations I got wasn't scientific enough for me. I wanted to dig deeper. So I went in a little bit deeper and I started just reading the publications. Now we're going to get into GHK in a little bit, GHK copper, and I read about that and that intrigued me. But then I went deeper and I didn't get the questions I wanted answered, so I just went right to the patents. So he has a whole bunch of patents, and I'm so impressed with these patents. But I read a few of them. I didn't read all of them, but I read enough to understand what he did and how he made this. Because I'm a frequency, I call myself a frequency nerd. So I love frequencies. I love reading about them all the time. So when I heard it was frequency, I wanted to see what's going on. How did he create this? So if you look at this slide right here, with that ladder looking thing on the left, right there where Dr. Stacy's circling, that's a ladder if you look twisted. Okay, they call that a double helix. It looks just like our DNA. But he created this, and this is not the DNA. This is actually artificial. And he can make that out of any material he wants, depending on what he wants to accomplish. So once he has the ladder there on the left and he twists it, then he brings it into a circle and connects the ends. So then you see that circle right there. That's exactly what he has, or what he made. Now with this circle, then he wraps a whole bunch of different wires around it, depending on what voltage, what frequencies, what electromagnetic field he wants to use. So whatever he wants to create that frequency, what's going to happen is he knows his little trade secrets there of how to create whatever frequency he wants in the center of that circle there. Go ahead and switch to the next one. So what I did here is I just put 432 hertz. Now, I don't know the numbers, though that's his trade secrets, and that should be his trade secrets, because he understands what frequency he needs to do what he's going to do to the body. Okay, so that's where I just put 432. And if anybody knows about frequencies, 432 is a very magical frequency. It really is. It's a cell regenerator and all that. So that's why I put that in there. But that doesn't mean he does 432. I don't know the frequency he uses, but I use this as an example so you guys can understand this is how he does it. But remember, if you have a frequency, you got to have voltage, okay? And what people don't realize is we are voltage. Our body is voltage. You know, we call it heat, we call it energy. All this stuff comes off, but it's voltage. So with this system here, you got to have an on and off switch. So what he created here is when you bring it close to the body, in your body energy field, guess what? That's electricity. And when that's electricity or voltage or power, it's going to turn that patch on. So it's really fascinating that his ingenious thinking, that he worked this out where he needed a power pack. He used us as a power pack. So what I tell my patients now is don't carry these in your pocket, you know, and don't carry them all around you if you have a whole bunch of them, because they're all on right now. And when you take them away from your body, they're off. So you have to remember that and tell people, because these patches only last for so long, because the heat of our body will destroy them after a while. And that's why the 12 hours also. So that's the technology and science behind it. But then my patients, when I talk to them a little bit deep into this with the presentations, they always say, well, that all sounds great. It's neat frequency. I mean, it's neat technology. But what's a frequency? What the heck can a frequency do to me? You know, I listen to music, I have a good time, it makes me in a good mood, but what does it do to me? So this is why I went a little bit deeper into the science, and we're going to go deep into the history of sound healing. So I tie this back to the good old Aborigines, the oldest culture people on Earth. Okay, now they say about 40,000 years ago, they use this one instrument called the diggergadong. You know, it's such a funny name, but this instrument here, when they use this instrument, it's hollowed out of very specific wood, and they do cycle breathing with their diaphragm to make a very deep frequency. But the frequency is always that same rough frequency. And what the Aborigines said is they did this because it heals bones, it heals cuts, it does pulled muscles, it heals illness. And they would claim that. So we look at our scientists today and say, yeah, that's just hocus pocus. They didn't know what they were doing. Well, guess what? I have two articles right here. If you look at them, those are published articles. Now, remember what I said about published research. Published research is a lot more, I guess, powerful, you could say, than clinical. Well, these are published research that weren't too long ago. And what does it say? It says this instrument, when played, it absolutely decreases stress. It absolutely generates cells. It absolutely creates healing in our body. So this is one example of Just sound. What does sound do? It does a heck of a lot to us. Go ahead and go to the next one. So then after the Aborigines, I go right into one of the cultures that I love to read about really a lot is the Egyptians. Now, the Egyptians were by far probably the most advanced, I guess, culture, if you read about them in the ancients, that dealt with frequencies. But what they didn't call it frequency, they call it toning. So if you look up toning in the Egyptians, you cannot believe what they did with toning. I mean, they did healing, yes, but they also did a lot with spiritual work. They did a lot with a whole bunch of other things with this toning. So way back in the Egyptians, they knew that sound was real powerful too. Next slide. So now we look at the Tibetan monks. A lot of people know about the Tibetan monks, and they were really isolated for a while, but not too long ago, they started to let scientists in. Now, the Tibetan monks, what they use with their frequency is they use the bowls, they use the chants, the gongs, even the bells, but they know specific ones to do specific things. What the monks said is, yeah, stress decrease, health, and all that. So this is another published article right here that the singing bowls for sure changes mood right away, and it's for well-being. And again, another good scientific article right here, a published article showing that what they claimed right back then does come true. And what's neat about this publication here, if you read it, the people that did a lot of meditations, they got very good results. But the people that knew nothing about meditations and got this treatment, they got better results, which is real interesting. And I'm really not sure why that happened. They don't know really why. But the people that weren't experienced got even better results than the people that were off of this healing. So I thought that was real interesting there. Next one. So now this gentleman right here, now you can see he lived from 451 to 536. So that was a while ago. Now he wrote a book. Now the book he wrote, in this book, it talks about 6 main frequencies that he used to help heal the body. Because his book was one of the very first books out there talking about, a medical book in China, and then also about how to do long life, a long span of life. And one of the treatments, again, was frequencies. And again, this was a long time ago. Next one. So now we come to the ones on this continent, the Native Americans. Now, the Native Americans, they were the last real culture that really used a lot of sound. And what they use sound for is for physical healing, but also spiritual healing. So when they hit the drums, when they did the flute, their flute was a big one with chants. They did very, again, specific frequencies. And what does this do? This stimulates healing. So again, all these cultures, way back from 40,000 years ago, all the way up to the Native Americans, consistently used sound. And it's proven with peer reviews that now we go back and study how they did it back then. It actually does regenerate cells and does what they claim it did. Next one. So now we get into the science behind the patch. Now you know about the frequency. Now you understand the history of why frequencies are so important. But now you look at the patch, and I'm going to talk about the X39. And the reason why I talk about the X39 is because that patch produces, has our body produce a real good peptide that's called GHK copper. Now, GHK copper, if you've never really dug into it, really does absolutely amazing things to the body. But he has figured out, David Schmidt has figured out in that patch what frequency is actually going to stimulate in the body. And when we go into GHK copper, it is really impressive if you read about it, the benefits this could do. Go ahead, next one. So now we go into, David Schmidt has a lot of clinical research. You can go to that one website. Correct me if I'm wrong, Dr. Stacy, but it's startx39now.com. I believe that's what it is. I've been there many times. And if you scroll down to the bottom, there is a lot of clinical research. He even mentions the patents in there and everything too. But the clinical research, I love browsing through it. Remember, it's still very good, very good for you. But to have that clinical research, but to get published is the next level. And that's what this slide is. So if you look at these 2 publications, this is right from the patches. And one of them says, for sure, this patch, without a doubt, stimulates GHK copper, for sure. So now we know when we wear that patch, that will go up in our body. That will be stimulated in our body. And we're going to talk a little bit about the benefits of that in a second, but you're going to see that is proven for sure in peer review. But then we go to the next one, and the next publication, sure, it says the GHK copper goes in there and so forth, but what does it do? It actually helps with metabolism, helps with a lot of different, and you can see these products that it produces in the body. And the percent and how high it comes up in the blood is absolutely phenomenal. So if you have not read these publications, I do encourage you to read them because it'll give you so much more confidence behind the patch. And now that I've been on the patch for, I don't know, 5 months now, I won't stop. I won't stop at all. I think they're wonderful. They've really changed where my focus, also changed my energy. And I really like this. And as I dig deeper into the science, because I've only, like I said, 5-6 months been in this, so I can't wait to get even deeper and deeper into it, which I will do. But everything I've read a lot on X39, everybody in my clinic should be on X39. Because X39, as I tell people, it's not just treating a problem. It's not treating a disease. What it's doing is actually making your body regenerate itself to the positive, not the negative. That's what's going on with the X39. And it's doing with scientific proof that this GHK copper is definitely being stimulated by that patch. And the more you read about this, the more you're going to see the benefits. Go ahead and go next slide. Now, the benefits right here, of course, wound healing, the infection control, the hair growth, the skin. The skin is really good with GHK copper. And then anti-cancers, even just overall health. So that being said, and those claims, it's a general patch that, like I said, is so good for the body that I truly feel every patient should be on that. And that's the science behind that right now. And hopefully that little presentation I gave here will show you guys a little more of why this truly works. Because this isn't just hocus pocus. This isn't just somebody standing on stage saying, hey, this is going to work. I can pull the science in, and now I understand why I feel the way I feel. Mm-hmm.
I love that. Wow. That was amazing. I love how you brought the sound. I know they're like a couple. Like, yes. I love how you brought the sound frequencies, right?
Yes.
The frequencies are everything. And I know you talked about that a couple of weeks ago when I was up there about how you use frequencies in your practice. Why it's such an integral part. Chiropractic is amazing. And then frequencies took that to a totally different level, right?
Yes. And if you want me to elaborate on that, in the chiropractic profession, when I came in, again, it was all new with this frequency. So I was treating and I was, the lone dog and so forth. But I did a publication. In my last publication, basically what it was, I'll give you a little outline. It was 249 new consecutive patients. So I didn't care about their pain. I didn't care about why they came in. If you were a new patient, you went into the study. When they went into the study, I wanted to see how fast I can get them 80% better. Boom, just like that. My average is 3.8 visits. So no matter out of 249 new consecutive patients, I, in the average, got them better in 3.8 visits. Now, the baseline I had to beat with traditional chiropractic, that is hand manipulation with multiple techniques. It was 24. So if you look at that, I came in 6 times faster with results. So that tells me right away that our body responds to the frequency very, very well. Very well. And all I'm doing with the machine is diagnosing it first with the frequencies and the analyzer to find which bones to adjust, which are locked up. And then I go adjust it with the frequency. And I know now when it releases because the frequency changes. So even though I'm mechanical, this is more physiology or chemical. It's all the same. It's influenced the body to do a reaction. That's what frequencies do. So I've been telling my patients for years and years, listen, 2 things are going to heal this whole body in the future, and it's coming right now. And the 2 things, it's not going to be surgery, medicines, and all that stuff. And I don't knock that stuff because it's still needed. But the mainstream right now, I'm telling everybody, sound and light is going to heal everything in the body, period. And this is the start. And how I know that is because for generations since I think man walked this earth, they've been healing themselves with some kind of sound. And
Mm.
that's why I said this is just built into our DNA. I really think it is. And because we get the results so fast, it's not because I'm just this miraculous person. No, it's because I'm using the right frequency to let this body energy heal itself.
Mhm.
That's what it's all about.
Right.
Hmm.
And so obviously that segued perfectly into Lifewave when you
Yes.
found out about that. And I know we were talking, you said, man, he's patented all these frequencies.
Yes, it's
He has
great.
been busy, right? David holds 150 patents.
I
And
love
so that's amazing, right? But he definitely knows the power of the body to be able to do what it should be doing, which is live in a state of homeostasis.
it.
And so
Yes.
this technology in a simple, easy, non-invasive, obviously, nothing's entering the body, but if the body's own light being reflected back and that very specific wavelength, like you said, that's his,
Hmm.
proprietary
Hmm.
information that we won't be sharing. We don't even know because it's
Yeah.
patented. We are in year 3 of our 20-year patent on the X39. But that really made it so simple for you, right? You dove into the patent before you dove into the studies. When we met, you're like, okay, so there's actually like more than this on these, couple studies. And I'm like, yeah, we've got a lot of them on all the different patches for 20 years. But you
Yeah.
dove right into the patents, understanding that side of it. And obviously what the patent says is elevating that GHK,
Right.
activating our body stem cells. And of course, the body
Hmm.
knows what to do in that state. So I agree with you with the, X39, every single person on the planet should be on X39. And that's our mission, is
Yes.
to share that with people. So let me ask you this. So you always use X39. That's your starting point, people. Have you branched into any other patches yet with your patients? Have you done anything else, any other patching yet? Or are you strictly X39?
Yeah, I do everyone when they're interested into it, I'll always say, well, we're going to start with 39, and then I go into their problems, and off of their problems, then I'm going to bounce from that. And because I'm a mechanical doctor, I deal with a ton of inflammation, ton. I mean that's it. So the Eon is the huge one for me now. So typically, what I do with patients is I say, no, the 39 is the base. We got to start with that one, and then I'll complement the 39 with whatever. Mostly, I do with the Eon. Eon is the big one. Glutathione, yes, of course, that's a big one. And those are the two big ones I'm really getting into now, because it's kind of new still to me, but I like the results. I like the results a whole bunch.
Can
Yes.
you can you share a little bit more? Because we always talk about inflammation being the root cause of disease in the body. What do you see with that, with inflammation being able to bring down the inflammatory markers? I'm sure you've recommended diet changes, your frequencies that you're using, maybe some nutritional types of supplements or things. Let's talk a little bit more about inflammation and how important that is to get that under control.
Right. Inflammation is, I always say, my nemesis. And why I say that is because it fights against me more than anything. As soon as the inflammation gets out of the spine, the joint, the elbow, the knee, whatever I'm adjusting, it's so much more effective and it corrects so much faster. But when that inflammation is in there, it's extremely hard for me to control. So before the patches, and now I'm using the patches, again, I'm new to it, so it's not huge of the results yet, but I'm seeing results, is I would do the diet. I would do the frequencies. I would do the ice. I would do all these things to calm it down. And as soon as that inflammation would get out of there, it would be great. But again, if you don't know the mechanisms of GHK, copper, and inflammation, let me explain a little bit on layman's term. So
Yes.
basically, a peptide. Now, this peptide, think of it as a protein. So this peptide's in your body. So we got the patch on us. Boom, your body gets stimulated. The GHK copper gets stimulated, and it's there. So what does it do? So this GHK copper, I explain to patients, is think of it as like a road construction machine. Okay, so here's a big road construction machine here, and we got beat up road over here, and then they got to clean up this beat up road. The beat up bad road, think of it as inflammation in our body. All right, so this GHK copper gets stimulated. Now it's going to go find the inflammation. Now, one thing that our body knows, and I tell everybody this, even though us doctors get big egos and all that stuff, the body's smarter than any doctor on this earth. I'm telling you that right now. So the body knows how to do what it needs to do and the order it needs to do. Okay, so when you get this, and let's say you have a headache, okay, and all of a sudden you say, you know what, doc, this patch didn't help, my headache's still there. Well, maybe you have something a little bit more in your body that you don't know about. More inflammation, more problems, more attention that your body needs. So your body's going to go ahead, and that GHK copper is going to go attack it. But what the GHK copper does is it finds that inflammation and it'll eat it right up. As it eats up that inflammation, it's laying new road or a new cell instantly right after it. That's what's so amazing about this GHK copper. And that's why when it first came out, it was huge in skincare was huge. And if you read about it, and so that's what's really nice about it. And then when you dig deep into GHK copper, I believe the discoverer of this, his name was Lauren Pickard. I believe
Yes.
yeah,
Yes.
yeah. And what's amazing is back in 1973, he did his thesis on, guess what, GHK, because he's the one that developed or discovered it. He couldn't even believe. He even thinks that it's an adaptation over time, where our body adapted to make this to survive throughout the ages. But he's a real interesting man. But way back then, even in the 70s and 80s, that's before this patch was in the thought in David's mind. He said that skincare is amazing with this. He even said it has anti-cancer, like you heard. He says the lung protection is amazing with COPD. He talked about anti-inflammatory, what I said, how it destroys the anti-inflammatory. He even talks about stem cell influence, just like you heard all this. But what I like is I heard this from the reps, from the videos of David and even Dr. Stacy and all that. So you're thinking, okay, are they just making this up? Are they, exaggerating? Because you always think that. Well, you go back and you read 1973, he was talking about it. And in the 80s, he was talking about the same things they're talking about now. So when I see that, listen, this is a wonderful product that he created here that is so easy to use, so easy to put on, and the effectiveness is just tremendous.
I love how you say that, because you said that in Michigan too. Like the inflammation just chomps up the road. This GHK just chomps up that inflammation, that road, and lays a new road at the same time. We can all picture that visual, right? Just picture your spine, all the inflammation. Let's get it out and let's lay that new road, perfect spine right below. And I've honestly been going to a chiropractor since I was 18. So that's 30 years, 31 years I've been going to a chiropractor. And I have never heard a chiropractor tell me ever, which is shocking to me, right? What you just said about the joints and things being hard to adjust or to stick, if there's inflammation in there.
Yes.
Which is surprising, because it does make perfect sense. We know we're in pain when we have inflammation. We know things are not functioning or moving the range of motion, but that makes so much sense when you think about your spine.
Yeah. And, to help a little bit about diet off subject, listen, think of sugar is inflammation, people, period. If you look at sugar, say that's inflammation. It doesn't taste good. It's inflammation. And then you'll stop eating so much sugar, because it's very, very addictive. I'll tell you, yes.
And I love that. Just look at sugar, look at the ice cream, look at the cake, look at the cookies, and say inflammation. No.
Yes. Absolutely.
Right. Which we know, diet is the foundation.
Yes.
Nutrition is the foundation, 100%. So we cannot escape that, right? You can't fix things unless you can get your diet in check. And not that you have to be perfect. We don't want to, we don't think you have to eat, clean, 100%, everything amazing. This is a journey. We're going on the journey, right? We're all going on the journey together. We're going to make healthier choices as we go, as we learn, as we educate ourselves. A lot of people just don't know about these things, right? They were only told what their doctor told them. Bingo. And so that's all they know to be true. And sometimes, I love that you shared these papers, these peer-reviewed studies. And sometimes, like, if you go to PubMed and you type in GHKCU, it can be daunting, right? All the information. Dr. John Harmon, I know you haven't had the pleasure of meeting him yet. He's a chiropractor on our team out in Idaho. And he actually just wrote a book on GHK and the different types of categories of health that it can benefit. And so there can be a lot of information out there. And, that's why we're so grateful you're here sharing your expertise and your knowledge and your background and what you bring to the table for this. And so thank you for taking the time to do that. But we do have some more questions, if that's okay with you. Okay. Okay, good. All right. So we do have a lot of doctors and practitioners on here. Because we are in our organization, I think we're over close to 400 people on here now. We're a lot of practitioners, people that they care. We care about other people. Yes. So we're body workers, and we're chiropractors, we're MDs, we're Reiki masters, we're acupuncturists and different things like that. So they want to know, how do you set up this in your office? How do you introduce this to your patients? Do you just buy wholesale and sell retail? Do you offer wholesale to your clients? How does that look for you in that situation in a clinical setting for the
Mhm.
people that are on here that are maybe wondering how they can incorporate this into their practice, or maybe even people that are not a medical or healthcare professional, but yet wanting to share with other healthcare practitioners?
Well, the biggest thing to bring in the questions, number one, we have signs up talking about Lifewave and they can read it. And even the meeting we're having today, I put it up there. So then that stimulates the questions on it. But the biggest thing is just exposing your patches. So as you can see, I have one right here, the Eon on my hand right here. So when I wear it, I like to wear it out because then patients are going to ask, what is that? Okay. Or my receptionist or my wife when she's in the clinic, we might wear them where they can see them. So the big deal is I do it so they can see them and they ask the question. I will bring it up if it's a certain thing. If I think they need an Eon, if I think they need the 39, I'm going to bring it up to them right away, just like I would with the laser I use, with all that stuff. But a lot of times I'm so busy, I don't bring it always up. So they'll bring it up to me. Now, when they bring it up to me, I tell them, okay, you can either come to a talk later on and we can talk detail about it. But the real quickness, what I always say is, this X39 is the base of everything. So if you want to start with one patch, you're going to start with one patch. And what I'm going to encourage you to do is you got to do this for at least 2 months. And the reason why I say 2 months is I did it for 2 months. And then you don't have to do anything else. And you tell me if you notice any difference. If you notice a difference, then let's continue and you can get more details about the company. Okay. If you don't like it, you walk away and there's no commitment. And what I do with them is I have them join as a silver. Okay, the reason being is because when you join as a silver, it's $299.99, $300, but they give you that little bonus, when you join of almost $50 free or something like that. So I tell the patient, listen, if you like these patches, then you're going to want to join as a silver anyways for the wholesale prices. All right. So if you don't like the patches, then you're not going to use them. But if you don't join as a silver, it makes no sense to me money wise. And the reason being is because let's say I flip out $150, $200. Okay, so I have $200 and I have a month supply, 2 months supply, or whatever, or even close to three. Then all of a sudden I like the patches. Now what do I have to do? I have to give them another $300. Yeah. So rather than that, what I tell them is get the little bonus right now. There's absolutely no commitment with silver. You guys know that. And then with that non-commitment, they can walk away and say, I'm never going to do it again. But if they can, they're already in, they're already ready to go. Then you show them about the wholesale and then you just go from there. So that's kind of how I spin that with that. Now, with the 39, I say everybody, but I know the patient's health. So if you're inflammatory, I'm going to say Eon. If you need glutathione for an antioxidant, I'm going to say glutathione. So it just depends on what the symptoms are, is where we'll go with it. But that's how I've been doing it in my practice only for about a month now. Maybe a month now, that's it. And I like it. The patients like it a lot. And they're really kind of excited because, they know a little of the technology, and then I'll tell them more and more. But I am such a busy clinic. I don't have time to sit there and talk 30 minutes to anybody. It has to be quick in and out, and then they can come to health talk later. And that's when I can fill in more of the details.
So tell me about your health talk, because obviously we did a couple of those at your office. So what's
Yeah.
that look like? Are you doing these monthly, bi-monthly? What
I
does that
used
look like?
Yeah, I used to do them a lot in the beginning. I mean, now 30 years in practice, I don't have to do them now. So I'm going to start them up again. Okay. And why start them up again is because I have a ton of questions from a lot of patients that are not just about chiropractic, but I want to get them this information. So these are the health talks, and they can be on any subject. I don't care what subject it is. We're going to talk about cholesterol, getting off statin drugs. We're going to talk about light wave and frequency. We're going to talk about the computer and frequency and healing. I don't care what the subject is, but what I'll do is that subject, I'll tie any healing into frequency, because any healing you can tie into frequency. I don't care what it is. Even drugs you can tie into the frequency. And if you know about homeopath, well, homeopathic is frequency. I mean, that's all those pills are. So it's just real wild how everything you look at, you can tie into the frequency. And then when you tie it into the frequency, guess what? You bring up the patches. I mean, so it all blends in. So it doesn't have to be a meeting for patches. It can be a meeting of how to eat, and I'm going to tie it in. So that's the health talks. They're open to any subject, any subject.
Love that.
Yeah.
That's amazing. All right. So someone has said that they have a number of medical professionals that they're in contact with, and they're concerned about peer-reviewed studies, as this person is. From what he has seen so far, the articles are published first in open journals, which allow pretty much any study to be published, and then possibly peer reviewed. So make no mistake, I have an extensive background in frequencies and their healing potential and effect going back since the 1980s. So how would you respond to that concern or question?
Every research can be ripped into, every single one. And yes, it does matter the journals. Some journals just accept everything, and I understand that being published. But if you're still published, it's still a little bit better in clinical. I don't care if it's an open journal or not. But it all depends on the article, though, too. And it all depends on how it reads and what they did. So there isn't one research project that I haven't read that I cannot, that I'll be able to find a weak link. Every single one will have a weak link. So if you want to rip this apart, you are going to find it no matter what. Okay. But what I tell people is, here's the clinical science, and here is a non-biased person of that one Pickard, I think his name is, that doctor that Pickard. He did all that research independently of this completely, and And if you look him up, I'm telling you, he's been since 73, 83, I think he started getting published. So with that being said, that alone is a whole separate group that's saying how great this product is. So with these doctors, all I would say is this patch is proven right here with this publication that it does stimulate GHK copper. Now have the doctor look up GHK copper in multiple different areas and multiple different ways of what GHK copper does. Because even though maybe David doesn't have a whole bunch of published studies, it doesn't matter. What it is the GHK copper. Why reinvent the wheel and say, okay, I'm going to do it on skin again. I'm going to do it on anti-cancer again. I'm going to do it on inflammation again. Listen, it's already been done. All he has to do is prove to me that, does this patch truly stimulate it? And it does, So that's how I would approach those doctors.
I love that. The work's been done for 50 years, right?
Yes.
The PubMed, all the studies, everything's out there on GHK. The patch elevates GHK. Like,
there you go. No problem. Right. So that's where, so push them towards the other research, just because this research shows that the patch does it. Absolutely.
I love that. Thank you. Okay. So a little bit more technical on the body side. Let's flip a little bit here.
Okay.
What about someone that has had a horrific accident and they're paralyzed at T5, 6, and 7? He has a cage in this area and has a lot of pain from the hard wire in his spine from the accident. Do you suggest any patches, or what would you suggest for him?
Well, of course, with the patches, I mean, I would even look at Icewave for pain control. You know what I mean? One of those, but I would look at the inflammation. Eon has to be on there. Glutathione also, and probably the 39 and 49. Now, I'm just getting into the 49 a little bit, and Dr. Sage, you can help me with this one, but I believe it's the increase of circulation and muscle tone. Those are the big ones. Those are the big ones with that. So if you're going to do that, what I'm doing with 49 is I'm going to complement what I'm doing with them. And why I say complement that is because increased circulation. So if I have the 39 here and then you put the 49, sure, you're going to get the muscle tone and all that, but look at the increased circulation. So if that happens, that means your body can work a little better and faster, of course. Same thing with the anti-inflammatory Eon and also the glutathione. So I would do that, but with somebody that's paralyzed, I take care of patients that are paralyzed. They need mechanical. And with that trauma, hand manipulation, that'd be really scary there. You can't. But with my computer with frequencies, I can treat any segment. I treat right after surgeries, a month or 2 months right after a fusion. Paralyzed? Oh, absolutely. I have some paralysis patients in my office, and we do help with that pain control. We really do. I mean, it just works amazing. And just to tell you a little story, I do have a teenager that unfortunately was in a car accident and he got paralyzed, but he's been under my care for a while. And I will be talking about the patches soon, but he's getting movement back in his legs. So even with those frequencies, the power of the body can heal, if that's going to be what God wants it to be done. So with this patient, I would look really at the mechanical frequencies to ease the pain, but then the Eon would be the big with the anti-inflammatory.
Oh, absolutely. Thank you for sharing that. I appreciate that.
Yeah.
So someone else was asking about scoliosis. That's obviously an area of expertise for you. So they're wanting to know about patches. But we know please share everything about what you would say on scoliosis. We'd love to
Well,
hear.
that's a subject that hits home because when I was 13 years old, I had scoliosis, and a surgeon wanted to cut me. He wanted to put the Harrington rods in my back. Okay, so I wore this brace, from my midsection all the way down to my pelvis, and I wore it for 23 hours a day, and I did it for 1 year straight. And guess what? My scoliosis got worse. So then the doctor wanted to operate. So there was actually a chiropractor that came and had dinner with my parents. And he said, give me your son for 1 month, 1 month. And if it doesn't work, you know what? Go get the surgery. Well, in 2 weeks, he fixed me. So that was my story of why I became a chiropractor, because one saved me from surgery. So I wanted to redo. So scoliosis is real passionate to me. And no, I have helped hundreds of kids with scoliosis, hundreds in my 30 years. With the computer, it's very easy to really diagnose that and treat that. Mm-hmm. But there's some scoliosis you can't cure. So it all depends. All scoliosis aren't the same either. I'll put it to you that way. They're a lot different. So I'm more of the functional scoliosis. Okay. If it's congenital, it's going to be rough. With the patches, what I would look at is, again, scoliosis patients have a lot of inflammation, a lot of tight muscles. So you're going to want to hit that with the Eon, the 39, to help those muscles calm down. And I believe it would be probably a 49 also. Wouldn't you say, Dr. Stacy?
Yeah, 49 would be great. Absolutely. Yeah. And sometimes, I know when I first met David 2.5 years ago, someone had asked that in the audience. And of course, we're not making any claims that it's like you said, it's not going to treat or cure it. But if you're looking at moving energy, right, and opening up those channels, Steve said, even if you put an Eon where that curve is to help with that inflammation, put a set of ice wave right below that curve in the spine to help open up that flow. He said in chiropractic offices, they've used, where you roll the scan along the back and you can see, what I'm talking about. Thank you. Yes. So they can see that shifts even in as early as 7 days.
Oh, wow.
Yeah. I know, with the Eon on the curve and the ice wave right below that curve. So definitely 39 is always for everything, right? And like you said, 49 helps with that circulation and, helping with the bones and the muscles. And we know all of that is intricately connected on our spine. Everything comes off your spine.
Yes,
every nerve, everything in your entire body is controlled from that spinal column, right? From your tailbone all the way up in here. So we've got to keep that in balance and alignment as much as possible. So
yes.
All right. So we have time for a couple more questions if it's okay with you.
Yes, it's fine. This is fun.
Good. Okay. So this is amazing. So they're asking about the brain. So neurologically, we cannot talk about any diseases. So you guys have mentioned different things in the chat here on diseases. So we're not going to discuss any type of brain diseases or conditions or diagnosis. But if you're looking at neurological benefits, obviously we know, X39. I don't know if you've had a chance to look at the brain mapping with the EEG studies yet.
I have not.
But those are substantial. In what they show with coherence. I was re-listening to David today talking about X49, his very first video that he did after the launch of it 2 years ago. And he was talking about this study and how they show changes even as fast as 3 weeks in the coherence in the brain and bringing down that anxiety level, right? Helping you look at the brain like thermography, right? Looking at the colors and same thing, seeing those changes and shifts. So what would you recommend outside of using the X39, of course, for neurological brain health type things?
Well, the 49 for the circulation. I mean, right away, I would complement it with that. And then with the brain, I really haven't dipped into those studies yet. Like I said, I'm only 5 months into this. So I'm really not sure what I would do that. I know what I would do clinically with it, but with the patches, I don't know. I probably defer to you right now, Dr. Stacy.
Okay, but I will take that back to me. Okay, so when you look at the brain, 39, of course, Eon reducing that inflammation.
Yes.
Really important, right? The inflammatory process. And when we look at our autonomic nervous system, which is your area of specialty, with the autonomic nervous system, we want to keep that in the parasympathetic state and keep the body in that calm, relaxed state. That is where the body is more apt to heal. Is that correct? If your nervous system is turned on, the sympathetic nervous system, if you're in that fight or flight mode, how easy is it the body to heal?
No, it's not.
No, so bringing the body in the parasympathetic state is a big responsibility of the Eon. Okay, we call that our happy patch. If you're happy,
That's true.
the brain's happy, right?
Mhm.
See that. And so those two are super important. But like you mentioned, the X49, what it does for the circulation, what it does for the brain with cognition, it really makes a big impact on the brain, on the neurological system. And I know I have a doctor acupuncture on my team, and she talks specifically about some different types of neurological issues. And she loves putting X49 right in the center of the chest.
Hmm.
That's where she loves it, like right below that sternum, right in that area, for those types of neurological things. So
Got it.
I love the X49. The other patch that's amazing for the brain is carnosine. Carnosine balances left brain, right brain hemisphere. It helps improve cognition, communication, all of your executive faculties. So it's amazing. It's an antioxidant, like you mentioned earlier, but it likes to hang out in specific places where the glutathione is more systemic. Carnosine is a big one for the brain. So I definitely recommend. And here, somebody asked, how many patches can you wear at one time? So when I first met David, literally like days into learning about Lifewave, he had on 13 patches. Now the company does not have 13 patches. And at that time, he'd only even invented 11. So we're all like, what do you do? What do you have on? And he said, well, there's experimental ones. I'm a guinea pig and I'm trying different things out on myself. So he was obviously perfectly fine. I don't recommend you wear all 12 patches on day one. Of course, like you said, I'm much like you. X39 is my go-to. Eon is right there with it immediately to help that inflammation. But can you patch with another patch after that? Can you safely put on a third patch or even a fourth patch during the day? What are your thoughts on that, Dr. Dan?
Absolutely, absolutely. I stuck with the two, but now, no, sometimes I have 4 patches on me. Sometimes I only have, 2. It just depends on kind of how I feel and what I want to do. And just like you mentioned, I experiment with this now. I know it's working. So now I don't know the patches like Dr. Stacy does yet, but I will. And now I'm playing with it kind of. And I encourage you to do that. It's not going to hurt, and then document. What I like to do is just write down your symptoms, right? Because a lot of times, that's another thing I wanted to mention. I'm glad I said document. There was that sheet that Cindy gave. I'm not sure if it's generalized.
The health tracker.
Health tracker, that's what it is. The health tracker, I like that so much because I can't tell you how many patients don't recognize and feel what they are and how they feel. They don't realize it. But if they do that health tracker, I guarantee you they're going to know, this did change stuff. Because there's some people that'll come and say, it did nothing. And then you ask them, well, you're sleeping better. Wow, I'm going to the bathroom better. Wow, I'm more energy, but it did nothing. It's those things that with those health trackers, it is good. So like I was telling people, experiment on yourself, but write notes, and you'll be surprised what these patches will do. So that's what I'm actually doing now. So yeah, I'm using more patches as we go.
I love that. Definitely. I agree. And people are wanting to know what patches are daytime only and which ones are nighttime only. So we know the Silent Nights and Alavita are nighttime only. That's it. X39, X49, Energy Enhancer, daytime only. Okay, those are daytime patches. The other patches you can do day or night. It's up to you. I don't recommend you flop those day and night ones for any reason. Stick to what's day and what's night, and then you can do the others as they best suit your needs. Sometimes people love the Eon at night because it shuts off their monkey mind, right? It helps calm their mind. It's not a sleep patch, but again, bringing the body in a parasympathetic state, they can calm down. Maybe they use the Silent Nights too to help with sleep, or the Alavita, which does help a little bit in that department as well. So you can, and they're asking if you can put one on top of the other. You can if you want to. It's not needed, not required, but you definitely can. Sometimes people put one like right below the other. We call that kissing them. Where you would put one below the other one. You can do that if you want to. Obviously, all patches have their own 12-hour window. So 12 hours on, take it off, throw it away. 12 hours. Next day, put it back on again, take it off, throw it away, wait 12 hours. So you have your own 12-hour. Now, like you said, document. Keep track. If you need to set a timer on your phone, I always tell people you brush your teeth in the morning, put your patch on.
There you go.
Oh, God, you brush your teeth, right? You're brushing your teeth at night, take your patch off. If it's longer than 12 hours before you go to bed, I know it is for me, you may be taking your patch off earlier, and there's nothing wrong with that, right?
Right.
So last thing, I've had so many people in here ask, remember, we cannot discuss any diseases, no diseases. Okay. So we're not going to address that. A lot of people are asking about heart health. Heart health is going to be the same thing when you're looking at brain health, believe it or not. And you know this, Dr. Dan, the heart and the brain are completely connected. That heart brain connection, that coherence is huge. So X39, Eon, carnosine, X49, those are our brain patches. Those are our heart patches. Okay. Can you use all of them? Yes. Do you have to? No. But know that those are the 4 that we look at for heart health. If you go back to my YouTube channel, Dr. Stacy, you will find back in February was Heart Health Month. And so I spent an entire month, every single Tuesday night, going over the clinical studies from our research with those 4 patches. I interviewed a cardiologist on our team that shared about his impact with his patients in his office. I interviewed an acupuncture doctor, the same one that I mentioned that put the 49 in the center of the chest. She had a presentation that we screen shared as well. And so go back to my YouTube from February. You'll see 4 weeks of heart health tests like these right here. Patching podcast Zooms, whatever you want to call these. We did these every single night. So go back to that for sure.
Good.
Yes. Okay. So we are all out for questions, which is fantastic. I am we have perfect timing on this. One minute to spare. So Dr. Dan, any last thing you would like to share with the audience of people that are here tonight? Any last bits of information or words of wisdom?
Well, I think we should, or you should just keep trying these patches. Don't give up on them. If you're new to it, definitely try the 2 months. It is so worth it because I think majority of the people is going to help. Now, this will not help 100%. I mean, there isn't anything in the world that's going to, but I think it's going to help a very, very high percent, and it's worth a try. And I want to thank you guys for Dr. Stacy having me on here, and thanks for just spending this hour with us.
Oh, thank you, Dr. Dan. I so appreciate your time, energy, and effort you put into your presentation, as well as being here to answer these questions for everyone. We value your time, and we thank you for everything you've done. So thank you for being here, and I look forward to seeing you again soon.
Yes, I agree. Thank you. Have a wonderful night. Bye-bye.
Thank you,